All right, we are going to get started on the business meeting. Please continue to eat, although, and if you have some really pressing conversations, we won't impose. But we do need to do this as part of the National Forum business. So we aren't going to call the roll, and because we know who all is registered. And so I think the first order of business is John's annual executive director report.
All right, thank you, Dr. Robinson. The Executive Director's report is brief and hopefully to the point. So first of all, as you will hear in our Treasurer's report in a couple of minutes, the National Forum is in the black, and we are keeping our expenses managed below our income, so living within our means. We have added funding from some additional sources this year, which is, of course, a welcome development, and maintain funding from our current or previous sources that we reported last year. Programmatically, we've been focused primarily on three things in the last year. One, our partnership with the American Heart Association in support of the Million Hearts Collaborative. And Jill Birnbaum and I co-chair the collaborative, and the National Forum plays a role in the evaluation of the collaborative's impact, and in convening and in producing or developing and disseminating communications messages each month, working in concert with Million Hearts at CDC. Second is our Value and Access Initiative, chaired by Dr. Robinson, and I will not go into detail on that because some of the speakers on the next panel will talk a bit about some of the work, and including some of the product coming out of it, not because it's a showcase for the initiative, but because it's pertinent to the panel. But suffice to say, this initiative is one that almost 2 years in now is bringing additional stakeholders in. We have people asking to become involved. So I think you may remember when we started this a little less than 2 years ago that it was in response to National Forum members saying, we want to get involved. Our membership, our board thinks it's important for our organization to get out on the playing field and engage on these issues related to value and patient access to innovative therapies. And we don't feel comfortable doing it unilaterally. We would really prefer to do it through the National Forum in concert with other organizations, other stakeholders. So our approach, being a convener, has been to bring together organizations, leaders of organizations, who represent patients, providers, payers, public health, and pharma and biotech. And I think most of the participants feel that that is a uniquely inclusive gathering. And now we're adding additional stakeholders, as I said. We're grateful for the support that we've gotten from Amgen and now from Sanofi and Regeneron additionally that helps to power that. We also, as you'll see a little bit later, are taking into account the contributions that we're getting from many of the participants. So it's a very inclusive initiative, credit going around, and we'll be hearing a little bit later about the impact that we've enabled many of our members to make through it and to accelerate their impact by being part of the Value and Access Initiative. The third focal point for the National Forum is Move with the Mayor. Our work with mayors such as Mayor Schmidt, such as Mayor Broome in Baton Rouge, to not only get mayors to exert leadership in bringing about culture change, driving a culture of health in their communities, and promoting more active lifestyles, more mobility, but also actually at the request of some mayors, assisting them in using policy and environmental change to make it easier for people in their communities to live healthy lifestyles. So that's been really important. We had, just to give you a quick example, we had a mayor with whom we met in May say, what about complete streets? By September, they'd built a tabletop intersection in that community. And then other mayors have been checking it out. So this works, and it's gaining traction and gaining support as well. We have a very brief video that summarizes how it's working, and it's where Debbie's going to pull it up. Thank you. Hi, I'm John Clymer. I'm Executive Director of the National Forum for Heart Disease and Stroke Prevention, an organization comprised of the 90 most dynamic, active organizations committed to preventing heart disease and stroke. For 3 out of 4 people, heart disease and stroke, the leading cause of death, is preventable. And all these organizations, through the National Forum, share information and collaborate to prevent the disease and reduce the number of people who suffer from it.
It's a great opportunity to get out and about with our neighbors here in this city, get moving, do our part around wellness, reducing our risk for cardiovascular disease.
Mayors around the country recognize that by helping people to become more active in their everyday lives, they can help to improve their cardiovascular health, help people be healthier and more vibrant in their lives.
I believe when people see me out walking or dancing or doing any form of exercise, bike riding, that it encourages them and motivates them to do something. You know,
mayors are using Move with the Mayor to lead by example, to show people that even the busiest people can fit a health improving amount of walking into their everyday routines.
That's how I hit my 10,000 step count. Say, Mayor Steve Benjamin, what's your step count?
This year on World Heart Day, we had mayors from across the country join together at the U.S. Conference of Mayors leadership meeting and have a giant Move with the Mayor walk that included hundreds of people from across the community of Columbia, South Carolina. So mayors from coast to coast, from big cities and small towns joined together, walking with residents, walking with workers, walking with students, and encouraging people to walk more and showing them that even the busiest people can fit a healthful amount of walking into their daily routines.
Hello America, this is Surgeon General Jerome Adams. I'm here in Columbia, South Carolina with Mayor Benjamin for Move with the Mayor. We are so pleased to be here on World Heart Day. Mayor?
Oh, we're having a ball.
71 million Americans do not get enough physical activity in their daily lives, and that increases their risk for heart disease and stroke. And by getting up off their sofas, getting out and walking more, perhaps from one meeting to another or other ways in their daily lives, by walking more, they can reduce that risk and have longer, healthier, higher quality lives.
You know, being mayor of Los Angeles can be tough. Sometimes I find it difficult to find the time for those workouts that keep my heart healthy. So now we take our meetings on the go. My staff loves it. Notwithstanding those changes.
Okay?
I would change that, keep that, and double that.
Can you sign this real quick?
No problem, you got it. Yes. Can you get this language? I would put it in French, I think it'll be better.
Got it.
Hey Anna, how's it going? And that's how I hit my 10,000 step count. Say, Mayor Steve Benjamin, what's your step count?
So I think that gives a real quick glimpse into the level of engagement that we've been able to get with mayors. In that video, you saw mayors from the West Coast to the East Coast, to the Deep South, to the area where Doug Robb and Don Shell were talking about there being difficulty in finding healthy recruits, fit recruits for the military. We're engaging these drivers of cultural, social, and policy and environmental change in this collective activity. Republicans, Democrats, big cities, small. So it's been kind of gratifying, and I am pleased to report that in the last week, the dynamic changed. So up until this point, it's been the National Forum reaching out to mayors to recruit them, to get them involved. Now we have mayors contacting us saying, how can I get involved, or get me involved? So we think this is ripe for significant growth, and it's a great opportunity for National Forum members who have apparatus in communities around the country to bring that advocacy ability to bear on advancing agendas together with policy leaders who can help accelerate your impact. So that's where we are with our major programs. We thank you. We could not do what we do without the involvement of our members and the engagement. And I think the level of interest and commitment that's been demonstrated here today shows that this is a movement. This is not just an organization. This is something much larger. So thank you. And now I think it's time for the Treasurer's Report.
Hi, good afternoon, everyone. First of all, I want to tell you how excited I've been this morning. It's been an exhilarating morning with a lot of passionate and motivational exchanges, and I think it only heightens the appreciation we have for the opportunity for us to come together. And I got to tell you about one of the financial reports I received a few years ago, where the gentleman got up and said, "We made some money, we spent some money, we've got some left." But I'm not going to do that today. I'm going to give you more information. Next slide, please. Or do I do it from here? Okay. Well, the Treasurer's Report, do I have it, John? Oh, you have it. Which one? This one? Yeah. Basically, the Treasurer's Report we have will show that on January 1st of 2018, we had $794,125.37. If you look at the balance sheet and compare 2017 to 2018, these numbers would reflect that. And I would simply caution you to notice that if you look at year against year, it's kind of hard to determine at any point when dollars arrive and when they leave. So I'd basically have you look at the year in total so that you can get an appreciation. And basically, I've got to tell you this. I've even complained about it at the board meeting, that John and his staff have done such a great job of reducing the cost of doing business until I told them that I'm afraid that they're doing so much more with less, they're going to do everything with nothing. So we got to find a way to help to get them the resources they need to continue to grow, and we'll be very effective in having that to occur. This third slide shows you the revenues of this year, and it'll show where you are at 2018 over 17 again, and you'll see revenues versus expenses, and you'll get a good sense of where things were. Okay, give you a chance to study those. And lastly, TBL, the bottom line. Our Wells Fargo account shows that as of October 18th, we have a balance in our checking of $256,023.36, and in savings of $407,000, $392.18. Lastly, for a total of $663,415.54. Lastly, I'll share with you one last thing as a point of personal privilege, which is, as we talk about motion and movement, I ask you to think of one simple formula: up one, down two. If we're in a building that has stairs, instead of having people ride the elevator, walk up one flight, walk down two. Makes a big, big difference. Up one, down two is what we want to get across to everyone, and we'll find that people will be in motion and they'll love it. I'll be happy to answer any questions you may have. If not, thank you for the opportunity to serve.
Thank you, Warren. And so now we need a motion, and then we can vote to approve the treasurer's report. So, motion? All right, so moved, second. All in favor? All right, okay. It's approved. So now we have some nominations. The executive committee, acting as the nominating committee, proposes the following slate for 2-year terms as directors. Jay Bott, Bernadette Melnick, Mark McEwen, Marcus Plesha, and Amanda Seif-Charney. So are there any additional nominations? Seeing none. I need a motion. Okay, second. All right. And all in favor? Aye. Okay, so approved. And as of yesterday, we elected new officers, Laura Gordon, the chair, Kim Stitzel, vice chair. Warren will, thank you so much, Warren, remain as secretary-treasurer another year, and then I transition into the immediate past chair. So, John, I think we have some awards that you can present.
All right, thank you, Dr. Robinson. And we presented at the board dinner last evening the awards. So in the interest of keeping the meeting moving, we will ask the recipients of the awards to just stand at your table so that you can be recognized before the entire group. And the first award is the National Forum Heart Healthy Stroke Free Award. It is presented to, there are two. One is presented to an individual and one to a group whose work has carried out the full range of strategies embodied in the National Public Health Action Plan to prevent heart disease and stroke. Our individual recipient this year has already told us a good bit about the work that in his city that led to our selecting him for the award, Mayor Jim Schmidt of Green Bay. The organization award goes this year to Hearts Beat Back, the Heart of New Ulm, which is a project of the Minneapolis Heart Institute Foundation. Ms. Rebecca, there you go. Congratulations, Rebecca. The National Forum Policy Award recognizes both an individual and a group who've been effective in advancing policy changes that reduce the burden of heart disease and stroke at either the national or state or local levels, sometimes all of the above. The organization award this year, the Public Policy Award, is shared by the Horizon Foundation and Sugar Free Kids Maryland, who successfully advocated for the passage of the Healthy Kids Meal Ordinance in the city of Baltimore, which then sparked Me Too movements in other cities. Shortly thereafter, Wilmington passed one, followed by the state of California. So think about how today trans fats have been banned from our nation's food supply. And remember, that started at the local level. That was a city policy. And in a decade, think about the powerful impact that made. So we're very excited about the work that the Horizon Foundation and Sugar Free Kids, together with Voices for Healthy Kids, have done to not only get this ordinance passed to the benefit of kids and families in Baltimore, but to spark a movement nationwide. And the individual policy award goes to an individual who had a hand in the aforementioned policy success, as well as a number of others, somebody who's very strategic and very driven at applying the policies that are on the agendas of all the organizations here, and particularly through her work leading not only Voices for Healthy Kids, but the Million Hearts Collaborative and other work at the American Heart Association, Jill Birnbaum. And Jill flew in late last night, so that was a surprise for Jill. So congratulations, Jill. The National Forum Commitment Award was presented last night to an individual who if this is your second, third, fourth, fifth, sixth meeting, you've seen her at every one, and you've seen her not just attending, but fully participating. Suni Dodani from Eastern Virginia Medical School. And the Chair's Recognition Award, selected by Dr. Robinson as chair, went this year to another mayor whose work you saw a little bit of in the video. She's really been a spark in her city for people getting out, becoming more active. And they've told her, hey, Mayor, my bike sat in my garage for 20 years, but when I saw you out riding yours, I got mine out and I'm on it again. Mayor Sharon Weston Broom of Baton Rouge. And Jacob Heimowitz is here from her office to accept on her behalf. And we ask that all of the recipients, as soon as we end this part of the meeting, gather outside for a group photo.
Okay, thank you, John, and thank you all for all the leadership we've recognized with the awards. So we'd like to recognize two of our board members for their leadership. Rod Wooten from AstraZeneca. He can't be here today, but he's served as a director for 6 years. And Dave Zook, who is here today, he's at Faegre Baker Daniels. He's served as part of the National Forum directorship, served as secretary, treasurer, vice chair, and chair. And really, Dave has been instrumental in our transition of the National Forum from an idea by the CDC into an independent organization that I think you can see, I think is really, really taking off and providing a key role in moving health forward in the United States. So, Dave, where are you? There you are. Thank you very much. So I'd like to call for any new business. And I would also like to have Laura Gordon come up. And I don't have a gavel to pass to you. But, yeah. But thank you very much. And I'll pass the gavel. And I'll call for a motion to adjourn the annual business meeting. All right. All right. Thank you.